I'm very excited, very honored to speak together with Nicola, of course. My name's Simone. I'm from the Netherlands myself. We came to the UK in 2009, so that's 16 years ago almost. Almost half my life. No, a bit less. I'm 46-year-old. I got Soufiane when I was 45. So Soufiane's 15 months now. He has Down syndrome, obviously. And when I did my 20-week scan, they initially said to me that they saw excessive fluid in his kidneys. So at the time, and I have other children, so I wasn't that concerned. I thought, that's probably a case of he didn't wee or something. I didn't have a clue that it could be related to Down syndrome, and I hadn't been told at the time because I think the sonographer isn't also allowed to sort of say something about that. So she did say that there was a concern, but she didn't say anything else. So I was referred to fetal medicine at that point, where we did other scans, and it was initially still the same. The excessive fluid was still there. 4 weeks later, it was still there. And at the start of my pregnancy, I declined all tests, and that's partly because of my religion. So I'm Muslim, and I reverted 25 years ago. So it's part of my religion that I'm convinced that anything that God decides for me, that's fine. And obviously God is, in my opinion, he gives and he takes, and whatever he gives us, that's perfect. So it hasn't crossed my mind. And also with my other children, I had always declined any tests before. Sort of naturally, I declined them as well with my latest pregnancy, until obviously the discussion came up. Like they saw an abnormality. What do you want to do? So I was a bit confused. I remember at the time. The doctor was a really lovely gentleman. I went to the women's hospital in Birmingham. He was really lovely, and he did. He left me the choice. I mean, I wasn't pressurized. I didn't feel like I had to do it, or he said it was completely up to you. And I remember asking him what he would do, I guess. And he was like, "Well, I like to have the knowledge about a certain situation. I like to know." And I think that sort of made me realize that I would like to know as well, in terms of that there was a possible chance, and I might be able to look into the subject a bit better, have some background information, know somewhat what to expect, I guess. So I decided there and then, when I had the second or third scan, that I did wanted to do the NIPT. So it was done immediately. And then they said, okay, you get the result within 7 to 10 days, which seems an eternity to me. So when they called, and I think it was actually after 7 days, I think it was a midwife or a nurse, I can't really remember, but they sort of said, "Oh, are you Simone?" And I said, "Yes." And then they said, "Okay, we have the results of your blood tests." It came back 99% positive for Down syndrome. And in the week prior to getting the results, I already cried my eyes out, sort of thing, because I already thought, what's going on? And I've never related the abnormality to be a sign of or a symptom of Down syndrome. So I was a bit all over the place. And when she said that, when I had that final phone call, I was a sort of like, I guess I was numb at the time. I cried so many times already that I just took it in, and I didn't cry. I didn't get upset. I just said, "Oh, okay." something like that, and that was it. But later I thought, well, when I thought back of that, obviously that conversation loads of times, and I did think it wasn't sort of the best conversation. Well, it's obviously difficult news to bring, but I do think no matter how the mom sort of responds or reacts, I think there should be a sort of at least a conversation about it, like a bit more maybe time, a bit more care, a bit more empathy. I mean, I like I said, I responded quite like neutral and not very bothered, maybe even, but obviously it's sort of, I was completely like shocked. And I even started thinking after we sort of ended the conversation, because it was just like, oh yeah, you'll have some other scans every like 4 weeks and that's about it. They didn't really say anything else, and I was like, well, what do I even know now? And I actually remember thinking later, okay, she said 99% chance, but what does that even mean? Like, in terms of, I actually, I actually remember thinking, does that mean that test is 99% accurate? Is that what she meant? Like, is it a yes or a no, and the test was 9% accurate, or is it actually a 99% that my child has Down syndrome? I was so confused. But even after that sort of conversation, I sort of was convinced that my child wouldn't have Down syndrome, and I would be the 1% that would beat the odds. That I was convinced, almost convinced, that was me. That 1% was going to be me or my baby. Well, fast forward. Well, luckily they didn't see any other sort of symptoms. So Soufiane doesn't have any heart condition. They didn't really pick up on any other sort of symptoms, so which obviously sort of strengthened my feeling of, see, there's nothing wrong, it's all going to be perfectly fine. And then when he was born with 39 weeks. The labor was induced because I had diabetes, gestational diabetes. So they said, okay, he's quite big and we don't want him to get too big, so that might cause problems. So we want to induce labor. Okay. So he was born 39 weeks. And whilst I've been thinking, probably from the 20th week of my pregnancy, all I could think about is Down syndrome. Once Soufiane was there, I didn't even think, like, he was born and he didn't cry. So I was really concerned, and I remember saying, "Why is he not crying? Why is he not crying?" I got a bit panicky, like, "What's going on?" And it turned out that was quite an interesting delivery, actually, because he was born in the sack. Like, that was really like an experience. And unfortunately, the midwives forgot to take a picture, so I don't have any proof. But yeah, that was quite interesting. But then I thought maybe that was the reason that he didn't cry. I don't know, but I didn't hear him. And then they put him on my chest, and he just looked the perfect baby. And I didn't think, oh, he has Down syndrome. I didn't think, oh my God, what am I going to do with him? I didn't think about the future. I just thought, that's my baby and he's perfect and everything's going to be fine. Until probably an hour later, but I don't think this really have something to do with Down syndrome, or maybe it does, but he turned out to have a lack of oxygen. So when he was on my chest, he looked fine. He wasn't blue. He was like perfect newborn, until the nurse came and she checked his SATs, and she was like, oh, I think there's something wrong with this equipment sort of thing. It must not work, because this can never be right. And I was like, okay, that's fine. So she swapped it for some other, and then she was like, oh, his oxygen is really very low. And then everybody got really shocked, and doctors came running in, and Soufiane got taken away from me, and they sort of gave him extra oxygen. And then we sort of got rushed into NICU. where we stayed for the 4 weeks. And then after 4 weeks on the day, we got to take him home. So we got to NICU, and the only sort of thing I remember that I found really important, because I think after this sort of initial happiness of having giving birth and adrenaline probably and everything that comes along with it, you feel okay, relief, and then it sank in. Oh, he has Down syndrome. All right. Obviously, I could tell, like, he had certain features that I didn't sort of recognize in that my other children didn't have. So for me, it was clear he had Down syndrome, but still, I made a point to chase up genetics, to do that test and to give me the results, and to, because I sort of had to see it. It came back he had Down syndrome, and yeah, I think when I got that letter, and it was given to me at the ward because I was there sort of all day, every day. The letter was given to me, and I think from that moment it started to really sink in. Like, okay, my baby has Down syndrome. And then I think, well, it was a complete roller coaster, I guess. It's very difficult to describe. I mean, one day you're fine, the other day you're a complete mess, but it's also, I guess, all the hormones still, and we were at neonatal intensive care, so it's a whole sort of different world than you're used to. So I felt it was very, very hard. But one of the things that I can actually remember is receiving the book from Positive about Down syndrome. And I think, Nicola, I think that's sort of a welcome sort of box, if I like it, with a book, and there was a little hat, and I think there was a card, and I do remember that was really sort of heartwarming, sort of although, to be fair, I have to be honest, sometimes I find it really difficult to look through that book. And I was like, okay, at times I was fine, and at times I wasn't, and sometimes I really didn't want to know. But I think that's one of the most important things that I realized, like, it's a whole journey with your child, and you go through all sorts of emotions from, even during pregnancy, and then after he's born, and then still now, although he's only like 16 months, but every little milestone, or you see other children doing certain things, you think, and there's still that bit of grief, sort of painful feeling that you think, and I mean, that's probably going to stay with me for the rest of my life and his life, I guess. But I was talking to my screening midwife actually this afternoon, and she was such a great support, and we had a lot of talks, and we cried together, we laughed together, and that was really that was a really very supportive bond that we had. And she mentioned, and I would like to sort of highlight this. She said it's very important that you allow yourself to feel those feelings, because you can be sad, and you can be happy, and you can be worried, and that's fine. And she said sometimes people feel sad, and they don't want to feel sad. So, say during pregnancy, they feel very sad that their child has possibly has Down syndrome, but they don't want to feel sad. So that might be a reason for them to terminate the pregnancy, because they don't want to feel like, sad or grieving or worried. Whilst I do think, and Nicola, I think, mentioned that as well. I mean, if there's more knowledge about the subject, then you will realize that there's not nothing, but not really that much to be sad about at all. And I think that's probably what I felt was very supportive through my pregnancy, that I was allowed those feelings, and We had, like, after every scan, I had a talk with the screening midwife, and we would just have a little catch up, but also talk about the weather and our holidays, and just very sort of not very, just a chit chat sort of thing, but also allow those other feelings to be there. And I think that's, and still for me, that's very important to sort of realize how certain things make you feel and allow yourself to feel it. Yeah, I've written out a lot of things. I have so many more things to say. Actually, we have to invite us back again, Sue.